What is public health? Let's start with a bit of history. History provides a perspective to form an understanding of health problems of communities and how to deal with them. We look at how past societies perceived and dealt with diseases. All societies have dealt with death and disease and in one way or another developed concepts and methods managing them. The history of public health is the story of the search for effective means of securing health and preventing disease in population. Public health evolved through trial and error as science evolved. At times, it was controversial and often made great leaps during times of war and natural disaster. The need for organized health protection grew as part of the development of community life, and in particular, urbanization and social reforms. Religious and societal beliefs influenced approaches to explaining and attempting to control communicable diseases by sanitation, town planning, and provisions of medical care. For example, the Black Death was spread by fleas on rodents. The plague ravaged most of Europe between 1346 and 1350, killing between 24 and 50 million people. That's approximately 1/3 of the population. Despite local efforts to prevent disease by quarantine and isolation of the sick, the disease devastated whole communities. Fear of a new and deadly disease, lack of knowledge, speculation, and rumor led to countermeasures which often exacerbated the spread of epidemics. In Western Europe, public and religious ceremonies and burials were promoted by religious and civil authorities, which actually increased contact with infected people. Meanwhile, the misconception that cats were the cause of the plague led to their slaughter. However, they could have helped slow the spread of disease brought by rats and their fleas to humans. Oftentimes, religious and social systems viewed scientific investigation and the spread of knowledge as a threat, resulting in the stalling of developments in public health. Today's examples would be the opposition of birth control, immunizations, and food fortification. So, how did we go from cats spreading the plague to having local health departments? First, humans got better at science. We as a species created things like the microscope, discovered how to make vaccines, made better improvements in agriculture that ensured better nutrition for the masses, leading to higher birth rates and lower death rates. And the growth of the middle class created overcrowding and thus a need to reform social conditions. With important implications for health, began what is now known as public health. The late 18th century was a period of growth and development of clinical medicine, surgery, and therapeutics, as well as the sciences of chemistry, physics, physiology, and anatomy. From the 1750s onward, voluntary hospitals were established in major urban centers in Britain, America, and Eurasia. In the 18th and 19th centuries, reform movements promoted health initiatives by the government. In 1798, the United States Congress passed the Act for the Relief of Sick and Disabled Seamen and authorized the formation of the U.S. Marine Hospital Service, which was the forerunner of public health service in the United States. Seamen became ill at sea and often were unable to find adequate healthcare in port cities. Voluntary municipal boards of health were established in some British and American cities in the late 18th and early 19th centuries. A central board of health was established in Britain in 1805, primarily to govern quarantine regulations and prevent the entry of yellow fever and cholera into the country. Town life improved as sanitation, paving, lighting, sewers, iron water pipes, and water filtration were introduced. In 1850, the Massachusetts Sanitary Commission was established to look into similar conditions in the state. Boards of health established earlier in the century became efficiently organized and effective in sanitary reform in the United States. The report of that committee has become a classic public health document. Reissued in the 1970s, it remains a useful model for a comprehensive approach to public health. Antibiotics and vaccines, along with improved nutrition, general health, and social welfare, led to dramatic reductions in infectious disease, morbidity, and mortality. Local health departments create and maintain conditions in communities that support healthier choices in areas such as diet, exercise, and tobacco. They lead efforts that prevent and reduce the effects of chronic diseases such as diabetes and cancer. They detect and stop outbreaks of diseases like measles, tuberculosis, and foodborne illnesses. They protect children and adults from infectious diseases through immunization. Local health departments also conduct programs that are shown to effectively make communities healthier. Modern local health departments may be entities of local or state government and often report to a mayor, city council, county board of health, or county commission. There are approximately 3,489 local health departments across the United States today. And that is a brief history of public health.